Thank you all so much for having me here today. I'd like to start by acknowledging the families and the young people whose experiences shape this work, and particularly the siblings of children living with childhood dementia, whose stories are so often unheard. For those of you who don't know much about my organisation, I'm going to talk to you a bit about what we do, but the majority of this presentation will focus on what we know about the impact on siblings and how they can be supported. I would like to acknowledge that I am joining you from the lands of the Kaurna people today. This is on the Adelaide Plains, and I pay my respects to their elders past and present and acknowledge their ongoing connection to land and sea. Siblings Australia celebrated its 25th anniversary last year, and I've been the Chief Executive since the beginning of 2023. Siblings Australia's vision is to ensure that siblings' needs are acknowledged in policy and practice, and our mission is to make sure siblings are seen and supported. We are very clear we aren't talking about carer relationships necessarily. We're talking about preserving the natural relationships between brothers and sisters. We are the only sibling-specific organisation in Australia, and the need for our services has only increased since the introduction of the NDIS and the devolution of block funding that meant that some organisations who had previously had capacity to run sibling programs themselves were no longer able to do so. For much of our history, we were a one-woman band, but in 2020, we were awarded ILC funding, which has allowed us to significantly expand the scope of our work. So today's presentation is informed by our 25-year history, both in terms of what we know about the experience siblings we've worked with and the research we've been involved with over that time. And what is clear, anecdotally and borne out by the research, is that when siblings are acknowledged and connected, they are resilient, and that impacts on the whole family. When a child is diagnosed with childhood dementia, the focus quite understandably falls on that child's medical and care needs. But in the background, brothers and sisters are living through their own version of this journey, one that is marked by a complex emotional terrain, medical uncertainty, and the gradual progression of loss. Research tells us that siblings of children with life-limiting or progressive conditions often take on lifelong roles. That might be emotional support for parents and the unwell child, advocates and interpreters for friends, teachers, and even health professionals, and sometimes as informal carers, helping with daily living tasks. Yet systems rarely recognise these roles. In 2023, we put together the Why Siblings Matter to the Australian Disability Strategy White Paper, which notes that siblings are almost invisible in policy and their access to structured supports is patchy at best. When their needs go unmet, the impacts can be significant. Childhood dementia combines the challenges of complex care with the reality of a progressive, life-limiting condition. For siblings, this can mean a number of things. An anticipatory grief is a significant one of those. This is grief experienced before a loss occurs, as the sibling gradually changes or loses abilities, and as the realities of a shortened life expectancy become part of daily life. Signs may include sadness, withdrawal, anxiety, or increased clinginess. Some young people show these in subtle ways: drops in school performance, irritability, or avoidance of home life. Siblings experience a loss of normal childhood experiences. Sports, friendships, and family outings are all things that can be disrupted by medical routines or unpredictable health crises. Siblings may feel that their needs are less important or selfish as compared to their brothers or sisters. And perhaps it goes without saying, but siblings have increased anxiety and mental health risks outside of the wider population. Australian and international studies consistently link a lack of sibling support to elevated rates of depression, anxiety, and social withdrawal. Research consistently finds that unsupported siblings were more likely to report difficulties with peer relationships, academic engagement, and self-esteem. In 2018, Siblings Australia compiled a survey which asked adult siblings to reflect on their childhood experiences. The outcome of that survey showed the following outcomes. Almost 84% of them reported that family stress was part of their childhood. Over 70% reported missing out on time or attention due to the requirements of caring for their brother or sister. 68% reported feeling isolated and that others didn't understand their experience. Over 65% reported anxiety and over 53% reported depression. Over a third of the adult siblings reported that sleeping problems were a part of their childhood. Siblings experience role strain, which may lead to maturity beyond their years. Some siblings take on adult-like responsibilities early, and while this can foster empathy and resilience, it can also lead to parentification, where the child's own developmental needs are put on hold. It's important to note that while there are risks, there are also strengths. Many siblings develop profound empathy and compassion, advocacy skills and a sense of social justice, and problem-solving skills and adaptability, amongst a raft of other skills. The goal when working with these families and looking to support siblings is not to remove all difficulties, because that is impossible, but to ensure that siblings are supported to navigate challenges in ways that preserves their mental health, their educational outcomes, and their own self-identity. Health and community professionals are well placed to shift the narrative from siblings as bystanders to siblings as part of the care team. This doesn't mean burdening them with responsibility, but rather recognising them in conversations and planning, providing age-appropriate information so they understand what's happening, checking in on how they are coping. And the literature shows us that even small acknowledgements, like greeting a sibling in the clinic or explaining procedures in language to them that they can understand, can help them feel seen and valued. It's really important to make sure that these brothers and sisters are being kept up to date. Kids will make assumptions when they aren't informed, and sometimes the bows they draw are so wildly out of kilter that their stress levels are more out of whack than they even need to be. I'm now going to get into some suggestions around possible proactive actions that you can take to support siblings. Identify anticipatory grief. You might ask questions like, how are things for you when your brother or sister is in hospital? Or have you noticed any changes in what it is that you can do together? Look for changes in behaviour, school engagement or mood, and refer to counselling or peer support where possible. Include siblings in discussions about illness or death. Tailor your language to age and developmental stages. Be honest but gentle. Research shows that shielding children completely often increases their anxiety as they sense something is wrong without understanding what it is. And use concrete examples. So when you're talking to these children, say things like, this might mean she forgets how to walk over time, rather than using abstract medical terms. Consider referrals to peer supports and sibling-specific programs. Siblings Australia has some evidence-based options that might be relevant. We've got SibWorks, which is our peer support group for kids aged 8 to 12, and it's a group program focused on coping skills and peer connection, and Teen Siblings, which is an online and local peer groups for siblings. If you're a practitioner on this call and you're interested, you can be trained in how to deliver SibWorks to your community. And please reach out to me if you'd like further details on that. There are some hospital-based programs in some children's hospitals, but these remain limited. Evaluations show that these programs improve sibling wellbeing, reduce isolation, and increase help seeking for brothers and sisters. Schools can be proactive spaces if they provide a go-to staff member for the sibling, make allowances for assignment extensions or flexibility, and respect confidentiality, but communicate with parents to understand what supports are appropriate. One practical approach is a school support plan that parents and school staff can co-develop. There are also languages and behaviours that should be avoided. Avoid minimising the situation for the sibling. Don't say things to them like, you're so lucky that you don't have to go to hospital. Avoid overburdening them where you can. Don't say to them, you have to be the strong one in the family. And avoid assumptions. Some siblings may not want to be involved in the care, and agency is a huge component of making brothers and sisters feel like they are in control. As professionals, you have an important role to play in supporting hesitant parents. Some parents fear that talking about illness or death will distress their other children. You can share evidence that age-appropriate honesty supports better coping and trust, and offer to facilitate conversations or provide resources. Reassure parents that not talking doesn't remove distress. It can leave children to make sense of things alone. One of the biggest barriers that our health and community systems is that our health and community systems are still built around the patient as the unit of care. In childhood dementia, the whole family is the unit of care. International models like the UK Young Carers Program or the US Sibling Support Project show that embedding siblings' needs in service pathways is possible. In Australia, there is momentum through the NDIS Foundational Supports Framework, or Thriving Kids, as we heard yesterday, but childhood dementia siblings risks being overlooked unless professionals advocate for them. So as I come to the end of my presentation, there are 5 points I want to make as I draw this to a close. Number 1, siblings are not optional extras. They are part of the family system which is affected by this illness. 2, early recognition matters. The earlier we identify distress, the more protective support can be. 3, practical inclusion works. A small shift in language or behaviour can have oversized impact. 4, cross-sector collaboration is essential. Health, education and community services need to work together. And number 5, you can be the catalyst. Often the sibling's first recognition comes from a nurse, a therapist or a teacher. If there's one thing to leave you with, it's this. Siblings carry the stories of childhood dementia with them for life. We have the opportunity and the responsibility to ensure that story is not one of invisibility, but of being seen, supported and valued. And it's always so important to remember that sibling supports leads to benefits for the whole family. Thank you.